Hello, everybody. Welcome. I am Dr. Andrew Neville. Nice to see you all. We're going to talk about adrenal fatigue here today, and we're going to talk about all the confusion behind it, what it actually is, what it actually affects, and it affects so many different things, what it actually causes, what it can potentially contribute to as far as dysfunction goes, as far as symptoms go, as far as chronic conditions go, because there's a lot. There's a lot. So we're going to talk all that through. I've got a list of questions. People have submitted questions over the past couple weeks, some that I didn't get to last week. I'm going to do everything I can to get to all those questions. So I've got a big, long list of questions. But if you have any questions, by all means, put them in the comments and we will do everything we can to be able to get those. They'll get those to me and I'll try to do what I can to answer those questions. Okay, a couple of housekeeping things. First, as you do join in, welcome. Let us know where you're from. We're always curious. We've got patients all over the country, international as well. So we've got a couple of international programs that we run now, a little more, a little better than we've done in the past. So let us know where we are. We're always curious. And I do have to say that this information is for educational purposes only. This content is not substituted for medical advice, diagnosis, or treatment. Always seek the advice of your medical doctor or healthcare provider with any questions you have regarding a medical condition. Okay, my legal team is happy now. Now, if you are a current patient of mine or a patient in our coach program, Core Plus, welcome. Welcome. I'm glad you're here. Please be here, listen, learn. We need to tend to hear this stuff again and again because unfortunately it's not second nature for a lot of us. If you have questions, you can submit your questions. If I have time, I'll get to those, but they will go at the end. Your questions are probably better suited for either office hours or coaching hours with me or with the coaches. Or you could submit them into the platform to get more direct, kind of individualized care. This forum is much more for the public, right? For people who are not patients, for people who have questions, people who are just confused. And, you've been there, right? We've all been there looking and searching, and everybody's, conventional medicine saying, I can't really find anything. Your blood work is normal. I don't know what's wrong with you. Here's, a referral to a specialist. So we end up on the specialist merry-go-round. And once we go through that merry-go-round, we end up to the other ists, which is usually a psychiatrist for a diagnosis of, hey, all this stuff is in your head. And if you have adrenal fatigue, anything can be further from the truth, but that's what conventional medicine does. And then when we go to alternative medicine, functional medicine, they're better about it, right? They dig deeper and they look at things. They'll pick up some secondary, tertiary conditions. But I actually find also that alternative or complementary care providers also tend not to get the depth of what adrenal fatigue is. And if they don't get it, they can't convey to us to the degree that we should get it and understand it. And it is so critically important for your health and well-being. So we're going to talk about all those questions. I will kind of talk a little bit about I've got a core program. Now, a core program is only, that's not with practitioners. So that's information only, educational stuff only, which is not ideal, but it is amazing. We're revamping that whole program. And if you're like a self-starter and you just need the information, tell me what to do, I'll do it. That's for you. If you can't, unfortunately, kind of don't have the financial resources to do one of the programs, this is a great place to start. So we're in the middle of revamping that. Currently, I'm doing a bunch of videos and kind of writing up a bunch of stuff for that. So if you're curious about that core program, if you put core in the comment section, we can get you on that wait list as well. And I think that's it. Am I okay on the platforms? They say I am. So that means we can get started. Again, welcome. Let us know where you're from. Any questions, just throw them in the comments and we'll do everything we can to get to them. Here we go. Amy says, in the realm of adrenal fatigue, when the adrenals are overloaded, I experience nervous system dysregulation and get stuck in fight or flight for 2 to 6 days, depending on how much stress it was. Is this common? And is this actually what happens? Yes and yes. And would you say as you recover from something, as you recover, this is something that becomes less and less intense? Love your work. Thank you so much. Thank you, Amy. I appreciate it. So 100%, right? So, our adrenal system is part of our stress response system. And that's really what this problem is. Adrenal fatigue is really a broken stress response system. Now, there's three parts to that stress response system. There's the puppet master, if you will, this limbic system in the brain, which calls the shots. That limbic system interprets our environment and has to decide whether or not a stimulus is harmful. Is it dangerous? Can this kill us? Do we have to jump our body into fight or flight to deal with it? Now, the way it jumps into fight or flight is twofold. There's a hormone side, which triggers the adrenals. That's the HPA axis in the adrenals. But then there's a nerve side, which is your autonomic nervous system, right? Basically the nerves to all the organs. And these systems work together to get us into fight or flight right away. The right away part happens via the nervous system because nerves happen like electricity. It's like that. Hormones would take a few minutes. And if you had to wait for cortisol to deal with the tiger in front of you, you'd be dinner, right? So we need the nerve side. Then we need the cortisol side. Kick in, jump into fight or flight, deal with that threat, and then shift back out. So when people talk about nervous system dysregulation, which is all the rage these days, right? Isn't everybody talking about nervous system dysregulation? They're talking about a part of your stress response system. When that system is overused over time, it gets trigger happy. So this limbic system starts to overperceive its environment as dangerous, right? So minor stresses don't generate a minor response anymore, right? Minor stress, major response. And we start to get stuck in fight or flight. We're trigger happy. We can't slide back out of fight or flight when we need this stress physiology to function throughout our days, but we want to be able to turn it on and then turn it off. It kind of gets stuck, right? And then we pay for it. And then we have a hit, right? And we'll have symptoms again for could be 2 to 6 days, could be longer, unfortunately. Over time, as we fix the underlying problem, bring this back into balance, rewire that limbic system, get the HPA axis normalized, do everything we can to treat that nervous system imbalance as well, target all those various things, and start to repair the body because stress physiology wreaks havoc on the body. Once we get all that repair going, what happens is as we shift this physiology, the symptoms that come from stress physiology, they decrease in intensity, frequency, and duration. So incrementally, those symptoms go away, whether it's fatigue or pain, could be brain fog, anxiety, depression, you name it, blood sugar, blood pressure problems, weight. Those symptoms incrementally will decrease over time. And then we'll feel a little better with increased intensity, frequency, and duration over time until another stressor comes around that hits us. Maybe that overflows our bucket. We get shifted. We pay for it again, but then we start to shift out of it faster. So it won't be 2 to 6 days. It'll be 1 to 4 days. And then it'll be a couple hours to a couple days. And eventually you'll take the hit and you'll be like, all right, I got to rise to the occasion, but then you'll shift out without suffering the side effects. So that's called stress resiliency is what that's called, which we lose, unfortunately, with, a bit of a genetic tendency, but then just enough chronic stress over time of any kind that overwhelms, right? That fills up our bucket too much. We lose that stress resiliency. So we get triggered and we get stuck so easy. And really, this is the crux of the problem, Amy, because stress physiology causes a bunch of damage in the body, and that leads to all the symptoms that I just mentioned. But at the same time, it leads to this suppression of the other side of our physiology, the other side being all of the organs that I've shut down that are not going to save me from the tiger that must be in front of me. Because I just want my heart, I want my lungs, and I want my sugar metabolism. That'll help the tiger, not my immune system, not my gut, not my ovarian hormones, testicular hormones, not my thyroid. We just shut all that down. Not detoxification. Forget about that. And you do that long enough, now you're going to develop secondary problems in those systems. And it's really attractive for people to try to chase after those secondary problems. Let's chase after the Epstein-Barr. Let's chase after the Lyme, the recurrent infections, the allergies, the histamine problems that we all have, right? Or we'll chase after the gut. I mean, I did all this, right? That's why my side, I treated Epstein-Barr. I can't even tell you how many times. Or they chased after my food allergies, my candida issues, my dysbiosis, call it SIBO, whatever you want to call it. We chase after all those things for so long. And, if you get it to go a little bit, you get enough behind it, maybe it feels a little better, but then it just comes right back because we're not fixing the underlying problem being that your stress physiology directly suppresses those systems. Stop suppressing those systems. And they can normalize on their own without treatment. You don't have to throw hormones, everybody. You don't have to, you sell all these fancy supplements and things to fix those things. So it balances out over time. There's a lot to it, right? There's a lot more to this stress physiology than just taking a little adrenal cortex extract or vitamin C or whatever. There is more to it, but it can improve and should over time. Okay, Nina says, how long after being on berberine should we start seeing positive changes? Also, I've read we have to cycle off berberine due to potential issues, harm to the liver with continual use. Is this the case? Okay, so berberine is a constituent that exists in nature in certain plants. It's a incredibly pharmacologically active constituent that I use on a fairly regular basis. It's rare, but on occasion we'll have to pay attention to liver enzymes, things like that. But I've used berberine long term in many patients without any problems at all. So it makes sense to kind of take a look at things, but generally that's not the case. I think those problems are blown well out of proportion. Now, it depends on what you're looking for as far as berberine goes. So the reasons I will use berberine is there's a couple things. The first reason I use berberine is it's one heck of an antimicrobial. I mean, it's pretty impressive as to what it treats. And when I say antimicrobial, that's broad spectrum, meaning it kills bacteria, viruses, parasites, yeast, a lot of them. And it's well researched and documented to handle, a few pretty very well, let me say. Even, so Epstein-Barr, if you had to go after it, or H. pylori, things like that. So I use it as an antimicrobial. One of the other things it does is it helps with our metabolism. So similar effects to metformin that doctors will put patients on for like insulin resistance, prediabetes, weight, things like that. So we'll use it for that to help with the mitochondrial handling of blood sugar and fuel. The other reason we use it is for this neurogenesis process, right? So there's neuroprotective actions. It crosses the blood-brain barrier, gets into the brain, and is effective at stimulating some nerve growth factors in the brain, which we always want to do to help with the limbic system in its interpretation of stress, helps with anxiety, depression, sleep, things like that. It takes time. And how long, I don't know. And the thing is, Nina, it's hard to say because I've never used it by itself. Like I've never said, oh, you have this adrenal fatigue thing. I'm just going to give you berberine. Let's see what that does. Chances are that would take years for that to do anything. I'm always using it in conjunction with hitting this thing from other angles, what I call figuring out what your therapeutic puzzle looks like with regard to this condition. Putting enough of those pieces of the puzzle, and supplements are pieces of those puzzle, but those are external, outside pieces. I start with the central pieces, right? Lifestyle stuff, dietary, mindset, all those various things. Those pieces are really key. Supplements, to me, supplements are just that. They're well named. They're supplemental to all of this other work. So it's all of that together that is really key. But I'd at least give it I don't know, probably a good 3-4 months plus to notice in combination. It's effective though, and I really I use it a lot amongst many other things. Okay, Rebecca says, I've been diagnosed with adrenal fatigue. I've been following hypoglycemic diet, but experiencing ongoing sugar lows, eat every 2 hours, prevent the drop, gaining weight, increasing anxiety. Will this resolve itself as if I continue to support the vagus nerve, supplementing, eating glucose? Not sure how common this is with adrenal fatigue. Okay, so blood sugar issues are a hallmark of adrenal fatigue because that's one of the main jobs your adrenal has, is to control your blood sugar. That's what cortisol does. Whenever your blood sugar drops, the adrenals are stimulated, cortisol has to come in and raise that blood sugar. And that helps us from slipping into a hypoglycemic coma, which is bad. When you do that too much, you put a lot of pressure on your insulin in your pancreas, right? Because cortisol raises the blood sugar. Insulin brings the blood sugar down. Like that's its job, is to get that sugar out of the blood. Well, if you keep raising your blood sugar with cortisol, now you have to keep using your insulin to get it down. And now you're going to develop this thing that we call reactive hypoglycemia, which is really just a dysregulation of blood sugars. It is a hallmark of this condition. And this is one of the precursors to insulin resistance, metabolic syndrome, and prediabetes, which, depending on what lab levels you're looking at and what research you're looking at, 88% of the country is on that continuum moving towards type 2 diabetes. 88%. It's pretty shocking. It's pretty shocking. That doesn't mean 88% people have adrenal fatigue, although it's not a small number. But so there's a lot to that, and there's also a lot to fix it. What I find is that the diagnosis, which I don't know if adrenal fatigue is a diagnosis, it's not official diagnosis. It's more of an assessment and an observation, right? And the thing is, adrenal fatigue is way bigger than just a problem with the adrenals. It's the whole stress response system together, which has to be treated in that way. And sadly, I find that most of my colleagues don't do the best job in treating that. But it can be treated. It can balance out. And what happens in my patients with our programs, is that their blood sugar issues incrementally improve over time. And usually it starts out fairly quick, but incrementally that gets better and better. And if it's not, there's probably something missing. And you could, if you wanted more information, you could reach out. I have a patient coordinator, Christine, who's one of the most compassionate people you could ever speak to. She's been with me a long time, knows her way around the symptoms and how to tease out the information and what's going on and see if there's kind of things that are missing. So a complimentary call, if you were curious about that, you can reach out in the comments, Rebecca. But that blood sugar issue should improve, not get worse. So if it's getting worse, something's missing, and that's probably not your fault. It's just this is bigger than what we've been led to believe. So you can fix it. Just you got to get the right guidance. Okay. Good luck. Eve says, and welcome everybody. Good to have you here. Nice to see you all. Let us know where you're from. If you have any questions, throw them in the comments. Happy to try to get to them. I've got some comments here, so I'm going to do my best, and my team is going to keep me on task. Eva says, when I go to bed in the evening, I sometimes get very warm in my body as much more tired I get. Is there an explanation for this? Is it due to low cortisol, more low thyroid? I'm trying to find my dose of adrenal cortex extract. Yeah, so hard to say, Eva. The temperature regulation is definitely associated with adrenal issues. Temperature regulation actually starts up in the limbic system. So many of my patients have a hard time regulating their temperature in response to it being cold. Can they heat up in response to it being hot? Can they cool down? We have heat intolerance, we have cold intolerance, we have cold hands and feet, we have all kinds of things. It starts with this limbic system in the brain. So that's a piece. But there's a lot of pieces to temperature regulation. There's a lot that happens when we do go to sleep at night and all of a sudden we're horizontal and the body has to adjust to being horizontal. It has to adjust to the circadian rhythm. So it's hard for me to say, is this going to be a cortisol or a thyroid thing? Usually the temperature problems with thyroid is going to be overall. Patients with thyroid problems just tend to run a little bit cold. It's not necessarily associated with a circadian rhythm of sorts. when things happen at a certain time on a regular basis, on a daily basis, like this happens in the afternoon or this happens in the morning or every night when I do this, if that happens, it's almost always going to be associated with your HPA axis because that's what determines your circadian rhythm, right? Cortisol is nice and high in the morning, right? Gets us up and animated, ready to tackle our day in the morning. And then it gradually goes down. It's at its lowest level in the evening when we go to bed. And that's a fairly nuanced process that is dynamic and sensitive. And there are a lot of other issues, other hormone responses and immune system responses, neurotransmitters that are wired to that rhythm. And if that rhythm is off, it throws off a bunch of other stuff. So it may need a deeper look is possible. Okay, Sarah says, how do you sustain the symptoms? How do you sustain the symptoms of adrenal fatigue from reoccurring once you've recovered? Okay, so once you recover, how do you stay recovered and not have things happen again? By learning what this condition really is. I mean, truly, that's the answer, right? And by the time patients go through my programs, right, whether it's a program with my coaches for 3 months, programs with me for 6 months, by the time they get through that program, the vast majority of them, I'm not going to say everyone, but the vast majority of them get it. And when you get it and you understand how this stress response dysfunction is affecting the rest of your body, how this stress response dysfunction has come to be for you, which is different than somebody else, right? All my patients, they come to me and their bucket is full, right? Their bucket of tolerance for stress is full. Now we all fill it up in a variety of different ways, whether that's genetics, we have a certain size bucket, or it could be childhood trauma, could be injuries, could be bad infections, or just life, right? A little perfectionism, a little I don't know, some bad parenting that happened to us, all kinds of different issues, right? Fill up this bucket over time. But how did this happen to you? Can you trace back what that looks like? And can you learn to live your life where you're continuing to maximize the size of your bucket on a daily basis, and you've learned to live your life so that your bucket's not full all the time. So that you learn to live your life where there's a little room in the bucket, life throws you a curveball, and you can handle that increase in stress without taking a hit. And there's lots of different ways we have to learn. Again, these are a variety of pieces of the puzzle. We all tend to fill up our bucket in different, unique ways. How do you fill up your bucket, and how do you not fill up your bucket on a regular basis moving forward? There's a lot to that, right? And it is different for everybody, but that's how you prevent it. I mean, my patients they'll come into me, and they could be anywhere from, 40 to 60% functional on average, some 10 or 20%, which is pretty rough. And their functional capacity will increase, right? 20, 30, 40, 50, 60, 70%. I'd love to tell you that it's a nice linear progression. It's not. I mean, it's kind of linear, right? But it's up and down, up and down, up and down, up and down. But the general trend is up 60, 70, 80, 90%, right? No matter how functional you are, you can overfill your bucket. So we got to learn not to, and figure out how to manage that. So you absolutely can, and we need to. Okay. Lauren says, when working on healing a dysregulated stress response system, do you typically find it's more difficult for patients to put EBV into remission when their labs show highly elevated IgG titers? Looking for some continued hope and healing. Many thanks. Okay. So, Lauren, I see Epstein-Barr labs misinterpreted all the time. everybody has been exposed to Epstein-Barr. 95% of the country has been exposed to Epstein-Barr. Most people had no infection whatsoever. They didn't even see it. Their immune system took care of it. No big deal. But now you've had a past infection, so you have IgG antibodies. Some people got a little sick. They had like a respiratory infection, but they didn't know it was Epstein-Barr. But their immune system took care of it. They have IgG antibodies. Some people got mono, pretty severe. Same thing, right? Now, Epstein-Barr is a herpes family virus, which we never get rid of. You never fully eradicate herpes family viruses. Epstein-Barr, herpes simplex virus, chickenpox virus, HHV6, there's a number of them. You never get rid of them. The immune system takes care of them, and then they lie dormant. And it's when the immune system is weakened and then the dormant virus reactivates, that's when Epstein-Barr causes a problem, or any of these viruses. And again, the number one controller of that immune system is going to be stress physiology. Stress suppresses the immune system. My Epstein-Barr used to reactivate all the time. I don't pay attention to IgG titers because all they signify, and again, this is based on the research, all that they signify is past infection. There's no research that I know of that suggests if somebody has a high level of IgG antibodies, is that any different than a lower level of IgG antibodies? Because it all means you have a past infection. If you don't have an active infection, I don't really care. And to have an active infection, you either have to have some kind of an IgM antibody. IgM is acute infection. IgG is past. Or the TEL is an EA, an early antigen. EA antigen IgG, if that's up, that's reactivation as well. Otherwise, I'm not paying attention to it. I'm really not. I chased after Epstein-Barr for many years with many really good, well-intentioned doctors, and it was a waste of time. It was not until I was able to shift this physiology that my immune system finally, I released the brake on it, and then I could just go on with my life. So I wouldn't pay any attention to Epstein-Barr. So, okay, so halfway to go and lots of questions. I'm gonna do what I can. Okay. How does low cortisol impact blood sugar? Great question, Siv. So when the blood sugar low cortisol, right? We got to think about what cortisol does. Cortisol raises blood sugar. So if your cortisol is on the low end, you can't raise your blood sugar very well. You're going to have a tendency towards low blood sugar. Now, again, when you have low cortisol, that's a point in time. We don't know, is it low throughout the day? Is it low all the time? Is it low only as a baseline and then you respond high? It's hard to say, but it's going to be tied to your blood sugar dysregulation. And here's the thing. If you have low cortisol on testing, it means you've got what we'll call adrenal fatigue. I honestly despise the name adrenal fatigue, but I'm stuck with it. I used to call it adrenal dysfunction. The problem is nobody searches adrenal dysfunction. They search adrenal fatigue. So I need to call it adrenal fatigue. It's not even adrenal dysfunction. It's a stress response system dysfunction. So if you've got low cortisol, it means you've got a problem with the entirety of the stress response, not just a cortisol issue. So there's a lot to that. Yeah. Okay. Nettie says, how does the thyroid not working correctly affect adrenal fatigue? Can you have hypothyroidism along with adrenal fatigue? The thyroid and the adrenals are intimately connected, but the confusion, the mistake that everybody makes is that they're on equal playing fields, grounds, equal level, or the thyroid comes first. It's not. And this is not a chicken versus egg conversation. The adrenals go south first. We know very specifically through research that adrenal problems, cortisol issues, when your cortisol is high, it goes to your hypothalamic pituitary thyroid hormone axis and suppresses it. And I would go so far as to say the number one reason for hypothyroidism in this country is because of stress physiology and adrenal fatigue. That's what you have to fix. It's almost impossible to normalize your thyroid function if your adrenals are not controlled, if your body is still stuck in a stress response. And that's whether you're doing medication or not. my patients have to keep playing with their doses. You're only going to get so far. And in fact, if you push the thyroid too far beyond your adrenal strength, you're going to crash even worse. If you've got a thyroid problem, you've got to check and address your adrenal issues. Got to. Okay. Most nights after dinner, usually after my shower, I get lightheaded, dizzy, fatigue, nausea, anxious. I take my pressure and it's 110/68. Usually take some sea salt that helps. To help. Doesn't really help that much. Not sure if it's low blood pressure. Probably. Cardiologist never seemed concerned and doesn't offer any advice. Well, that's not surprising. So after dinner, shower, lightheaded, dizzy, fatigue, nausea, it's going to be low blood volume. That's what it's going to be. It's essentially low blood volume. Now it's not only a sugar issue. Sorry, it's not only a salt issue with the HPA axis and aldosterone that helps you hold on to salt, which means you hold on to water, which means your blood volume's high enough. It's also an autonomic nervous system problem where, we can't sustain the sympathetic output that it takes to keep blood in our brain when we're vertical for too long. Add some heat to that, and now the body's trying to cool down, and you're getting hit with both adrenal and with autonomic nervous system symptoms of your stress response system. So to me, what that means is don't just take Celtic sea salt then. Probably should be taking it on a regular basis over time, paying attention to all those symptoms. But I can almost guarantee this is a stress response system dysfunction symptom that means, so it's not just as easy as just popping some salt pills or taking some Celtic sea salt. You have to treat the entirety of that system to bring that back into balance and to strengthen it. So it sounds like you need a little more guidance or better guidance or whatever that may be. And I talk about guidance quite a bit. I've been doing this a long time. And unfortunately, what I've realized is that this condition is handled poorly the vast majority of the time. And that's, and that's across the board, certainly conventional medicine, but I also see well-intentioned functional medicine, integrated medicine doctors, right? Chiropractors, naturopaths, nutritionists, whoever, right, is believing in adrenal fatigue. Once they find it, I find that they just grabbed the hold of a tail of something. It's way bigger than they anticipated. It's way bigger than a problem with just your adrenals. It's that entire stress response system, and you have to treat it all as one thing. And it's more complex than just taking some DHEA or taking adrenal cortex or vitamin C. Sometimes it requires some expertise and some guidance. That's what we offer. If you need help, it's okay. I'm a YouTube guy, right? I will jump on YouTube to learn and try to fix just about anything, right? Even my car, right? I was looking at a thermostat sensor and realized I should probably just check my radiator fluid. And sure enough, that was low, right? But I'm not going to dig into my transmission based on something I just saw on YouTube. I know my limits. It's okay to ask for help. It's okay to need somebody who's an expert in this stuff here and there. So, all right. Sarah says, yep. I fear that my adrenal fatigue will come back. If I respect my functional capacity and keep taking my supplements, how likely is that? I think I kind of answered that earlier. It's just about, it's about maintaining life. You shouldn't need supplements, right? You shouldn't need supplements forever, right? We use supplements, and I use supplements, but you use supplements to fix the problem and then eventually get off this stuff. Like if you need supplements forever, it means we're not fixing the problem on a deeper basis. That's what we need. That's what we need to do. In the beginning, a little bit of fear is okay because it kind of holds us back in my experience. But you should be able to get to the point where, so this is what I do with my patients. I kind of ramp up support. As we ramp up support, we get that physiology to shift and they feel that. They feel the symptoms decrease in intensity, frequency, and duration. They feel a little more of themselves. Same thing, whether it's mood, cognitive function, energy, things like that. And then we keep them there as long as we need to, depending on circumstances. And then eventually we get you off this stuff and get you to go out, live your life, and stay away from as many doctors as you can. Seriously, including me. Like, I don't want you to need supplements. I don't want you to need me or my coaches. I want to be able to teach you what's going on, help you understand what's going on. What is my body telling me, so that you don't need that kind of support anymore? I mean, that's what happens. So it can happen. Katie says, hi, Dr. Neville. You mentioned in one of your YouTube videos to avoid broccoli, cauliflower, and cabbage. Does that also extend to kimchi and sauerkraut? Yeah, kind of. So you're talking about fermented kimchi, sauerkraut. These are fermented products, which are definitely better. I'm a huge fan of fermented products, but they're still cabbage, which means they're in the brassica family. Brassica family vegetables do have anti-thyroid actions. You don't have to avoid completely. So I'd like to see that quote where you got that. It's not avoid completely. It's just, variety, right? You can have it here and there, but just not a ton. Like if all you're eating is broccoli, that's probably not a good thing, right? You want to mix it up with some other vegetables, but brassicas have an anti-thyroid activity. So just don't eat a ton. Georgia says, can you explain why we have dizziness and what we can do to heal it? I was adding 1/4 teaspoon of salt to my water twice a day, but my ankle started swelling. Yesterday, I didn't have any salt water and my dizziness is worse. Is this related? Okay, Georgia. So I'm going to send you back to the YouTube channel, and it talks about what I just talked about with Jay in the shower and the HPA axis and the autonomic nervous system, how that affects how much blood we have in our brain, which turns into lightheadedness and dizziness. Anybody with adrenal problems, we tend to need more salt because our adrenals help us to hold on to salt, and salt is key. Salt gets a bad rap in society today, but salt is absolutely essential in our body. It all boils down to these sodium potassium pumps that are in every cell, thousands of them, which are hugely important. But if you don't have enough salt, you can't hold on to water. The challenge with some people is where they're holding on to the water in their body. The fluid, the water, should be inside the cells, or it should be in the blood supply, veins and arteries. It shouldn't be in between, in the tissue space. And when it's in the tissue space, that's when we get edema. We get lines on our ankles swell, our rings don't fit, things like that. So it's where your body's holding it. A lot of patients need salt, but don't tolerate the salt. So my recommendation is always just go slower, look at tolerance. The cells are damaged in my patients as well. The cells take a hit from oxidative stress, from stress physiology. So we got to repair the cells as well. There's a big, got to repair the cells, like a big marketing play. Like, no, duh, you have to repair the cells. Of course you have to repair the cells. Yeah. So anyway, you got to repair the cells, of course. But you got to do it all together, and you got to listen, you got to listen to your body. So, and sometimes, that might require somebody checking in on you. So, okay. Sherry says, any idea of bad circulation in lower legs and feet is adrenal related? I always have cold feet since childhood, and as of recently, they've been turning purple and numb, getting concerning. Yeah. So the big thing, Sherry, is that you want to know, it's hard to say is there any one symptom that can be associated directly with adrenal fatigue. I mean, I can say there's a few, right? But when I'm always in doubt, I send people to my symptom assessment tool. So on my website, I've got a symptom assessment tool, 4 or 5 minutes, fill this thing out. It spits out the likelihood you have adrenal issues. And if you have adrenal issues, then that adrenal problem does affect a number of different things, and it does affect circulation. So we do see a lot of cold hands and feet. Now, there's also autoimmune issues there that happen. So inflammatory issues, kind of a Raynaud's kind of a system situation, which is more, more with your fingers, but it can be other tissue, things like that. When in doubt, you always want to go to a specialist, get things checked out, right? That's the way to go. Get things checked out. Let them assess you, be conservative, be cautious, but then go back to the basics and dial all this other stuff in. So good luck, sir. Okay. Shape Lounge says, if DHEA is low, Could DHEA supplement help with adrenal fatigue symptoms? Sure, it could. The thing is, in order for someone's DHEA to become low, there's a world of stuff that's gone wrong. So with the adrenals, it's just not as simple. And we all want it to be simple, right? Oh, come on, I'm hypothyroid. Let me just take some thyroid hormone and I'll feel better. And you will. You will. I mean, you got to fix your adrenal issues, but you will. My ovarian hormone, can I just take some ovarian hormones? Sure, you can take those. Can you do that with the adrenals? No, you can't. Because in order for your adrenal hormones to go south, this whole stress response system physiology has been problematic, chances are, for years, if not decades. And adding a little DHEA doesn't fix all the damage that causes. And in fact, it's that problem, right? That broken stress response system. That's what suppressed your ovaries, why you need ovarian hormones. That's what suppressed your thyroids, why you need thyroid hormones, right? It's that problem. To get a low DHEA, you have to have enough chronic stress over time where the body's not making DHEA anymore. It's just trying to fight the tiger. And when you're stuck in that physiology, the amount of wear and tear on your physiology is tremendous. Every cell, inside and out, head to toe, every cell gets affected and damaged potentially from that stress physiology. It's crazy. When you look and you dig at the PhD level research into the problems that stress physiology causes, and it's there. Conventional doctors won't acknowledge it, but that research is there. It is profound. It's connected to every chronic disease you can name. Cardiovascular disease, stress-related. Diabetes, stress-related. Cancer, stress-related. Autoimmune disease, stress-related. It's there. So I make that contention. In the beginning, I said that, and it's crazy, but it is true. I don't mind trying to fix this. Here, take this herb for your heart or your metabolism or whatever, but fix the underlying problem. You fix that underlying problem, now you're getting somewhere. Now you can fix this, not need herbs or meds, and you can get on with your life. So do I use DHEA? Sure. Does it fix everything? Absolutely not. All right. I'm trying. Muhammad says, pretty sure I have adrenal fatigue. Is it possible I have hypoglycemia without adrenal fatigue nor diabetes? Probably not. If we look at the percentages, there is something. True hypoglycemia is incredibly rare. It's actually a liver disorder, incredibly rare. That's not what we're talking about. We're talking about reactive hypoglycemia, and that is not rare, incredibly common. Chances are that's what you have. I know hypoglycemia is part of adrenal fatigue. Hypoglycemic diet, 100%. And how can they get into ketosis? Seems impossible. I believe my hypoglycemia worse than typical hypoglycemia. Typical hypoglycemia stick to. Yeah. Okay. So, in general, like anybody can get this kind of free information on my site. Like a hypoglycemic diet is small, frequent meals, more protein and fat, low sugar and carb. Can I tell you how many calories to eat? No. Can I tell you how many grams of stuff to eat? No. Can I tell you your macros? No, because it's going to be different person to person to person to person. And that's the frustrating part with this. I can appreciate that. Trust me, if I would love to be able to create a cookie cutter approach to guide everybody. Doesn't exist. The general guidelines you want to stick to and then manipulate it depending on how you feel, right? That's really the key. And if it's more complex than that, you can go, look at the symptom assessment, see if the other factors of adrenal fatigue fit. I can almost guarantee if you've got a blood sugar dysregulation problem, chances are it's adrenal related. And that's really what you need to continue to tap into. Okay. Ollie, O-L-I, I'm probably going to say that wrong. My apologies. Why does taking a deep breath into my upper chest cause me to feel pressure in my chest and black out only after a few seconds? And how can I reverse my symptoms? Okay, Ollie. So I don't know. Like I'm an adrenal fatigue doctor. I'm not going to kind of dig too deep into this. What I can tell you is that, breathing is an autonomic nervous system function, breathing in, breathing out, right? We should be breathing not up into our chest, but into our belly. When we fully inflate our lungs, it pushes our diaphragm out and our belly goes out, right? So it's hard to say kind of exactly what you're dealing with. I don't know your health history. I mean, I'm going to have to recommend you just get checked out. But I've got to leave it at that. Sorry. Nancy says, how often do you find SIBO or SIFO as coexisting problem? What do you do to diagnose and what do you do to prescribe? Yeah, so maybe these things all the time is the answer, Nancy, and maybe these things coexist, but the most important is to fix the underlying problem. So I had a woman come in, it's a couple of years ago now, I had a woman come in, SIBO. She was treated by, some integrative doctors locally 4 times, antibiotics, right? Special antibiotics designed to treat SIBO 4 times. She comes into me, I keep getting SIBO. I'm like, all right, well, let's talk about the rest of your health history. How about that? We talk about the rest of the history. Sure enough, she's got to have adrenal fatigue, do the testing. She's got adrenal fatigue, put her through the program. And I told her in the beginning, I'm like, look, I'm probably going to ignore your SIBO. And she was apprehensive, of course, at first, right? Because everybody had said, oh, it's your SIBO that's causing all your problems. The SIBO is a result of that stress physiology suppressing the digestion, suppressing the vagus nerve, damaging the mucin lining, causing inflammation in the gut, not properly digesting food, dumping undigested food into the gut, developing food allergies, dysbiosis of all kinds. And we have all these fancy names, SIBO, SIFO, and all that stuff, right? I don't care about those things to the greatest degree. My focus, let's fix the underlying problem. And that's what happened with this young woman. Address the underlying problem. The SIBO went away on its own. I didn't have to go crazy chasing it. And then she could just get on with her life and things normalized. That's what I would do. All right. Christine says, what is the recommended saliva test called to help determine your cortisol levels? Can I order it myself out of the country? Yeah, so if you're out of the country, no, I use a lab called Diagnostics out in Seattle, and they don't provide that test out of the country. There are other labs that are doing saliva tests. We have international programs where, we will do the assessment, right? Because yes, you want to get the right test, but you want to get it assessed the right way. And I can't tell you how many saliva tests I've seen assessed inaccurately. And the frustrating part about that is, people will come to me and they'll have a saliva test from 3 years ago and somebody assessed it inaccurately and then went chasing a bunch of other stuff. Oh, it's not that. Maybe it's your candida. Maybe it's your Epstein-Barr. Let's treat Lyme for a couple of years and see how you do there. And then they come into me and I'm like, you had adrenal fatigue back then. So it's the assessment that's important. Mostly, a lot of labs can do saliva testing nowadays. A lot of times for international patients, we're doing a dried urine test called a Dutch test. That's an acronym for something. Dried urine, chronological, comprehensive hormone, something like that. Anyway, not a bad test. I'll see those quite a bit as well. But you have questions. If you have questions, reach out, put your information in the comments below and we can reach out to you because it's the testing, but also the assessment of the testing. And of course, then the guidance and our international programs work really well. Okay. We're getting there. I don't know, 10 minutes. I'll do what I can. How long? And I'm going to do what I can, but just so you know, there's a lot of people on the call. So we are in the process of setting up a subscription. So we're going to do a membership subscription in, I think one of the other channels. I think it's going to be on YouTube where we do a similar type of a situation, but it's by subscription, which is going to allow me to go much more in depth and talk a little bit more on a little bit more of a personal level, kind of a slowed pace as opposed to this shotgun kind of approach where we're just trying to get the information out there, get a little more specific, a little more targeted, where we do that twice. We're going to do that twice a month. And there's a bonus that's going to be in there as well. But it's going to be a membership so that it's a little more exclusive. I'm going to be able to do a little better work. I like getting this information out there, but I hate that I can't give the questions the kind of the justice and getting into the deep dives and what to do about this stuff. Now, it's not you're still not my patient, right? So I'm still not, diagnosing and assessing and that kind of a thing, but we can go much more in depth. So we'll let you know. We'll let you know when that's out there as well. Okay. Be Cozy says, how long does it usually take to fix the circadian rhythm? Oh, it depends. It depends on about 100 different things, Be Cozy. So I'm not sure really how to answer that. If it's done right, with us, I mean, I can see it happen in a month. In a month. Some people are a little more stubborn. So sometimes even for us, and we do this stuff fairly well, even for us, it can take 6-8 weeks. It can take a little longer. And it's not right. Like we don't snap our fingers and all of a sudden it's fixed. Right. I mean, it takes some time to balance that out, but it does balance out and it should. And if it's not, then again, sometimes we have to be patient, but it should be able to be fixed. Angela says, why does my heart start pounding randomly sometimes when I'm relaxing or sleeping? My doctor tested me for apnea. Don't have that, but variable heart rate, saliva test, found low cortisol, but believe that has improved some. Yeah. So Angela, if you have low cortisol, you have a stress response system dysfunction, which is going to include your autonomic nervous system, which is going to include the sympathetic nerve to your heart, which is going to cause random palpitations and, overexcitability within that cardiovascular system. That's what's going on. What can cause that? A lot of different things can cause that. This is part of the challenge, right? When symptoms remain and symptoms are still there, it means that you're missing at least a few pieces of this puzzle that's not being put together for you efficiently to effectively get that physiology to shift and stay there. That's the problem, right? Got to be able to figure out those other puzzle pieces. Okay. Good luck. Megan says, this is a long one, so I'm going to go through dealing with chronic fatigue syndrome past years, right? Fatigue, muscle, I get it. Blood work normal, get it. Can't work. I'm sorry. No money. Not getting better on my own. Is an endocrinologist, psych, or psychiatrist really needed to get better? No, unfortunately, they're not going to be able to help you either. Or is it all about self-motivated diet, vitamins, supplements, blood sugar? Yeah, I mean, you said a mouthful there, Megan, right? Like, is it all about self-motivated diet, vitamins, supplements? I mean, vitamin supplements have to be targeted. Blood sugar, pacing, stress reduction. Yes, it is, but not only, right? But not only. So you say you have no idea what to do next. Here's my recommendation. Just write a comment, right? Write a comment in the comment section about that. And I would talk to Christine. So Christine's my patient coordinator. Free call, complimentary call, have a conversation. And what she will do is listen. And this is not a sales call. There's no pressure with regard to this. She'll just tell you kind of what's available, what guidance we can provide, whether it's low cost or, more cost, like the program with me is cost something, of course. But there are low cost options to be able to guide you, basic stuff. What I would also suggest is you go to our dedicated Facebook group, Healing Adrenal Fatigue Holistically. And there's tons of support. Again, this is a different kind of group. It's not for, it's not for guidance and support. You're not going to get people doctoring you or anything, but it supports kind of the way I look at these various things. And there is some free guidelines within there. There are guides up at the top. So minimally check that out. And again, it's a private group, but anybody can join that public. I have some patients in there, but most are not. But call Chris, reach out. We can schedule a call with Chris and she can help you out. You can fix this. And the degree of disability that adrenal fatigue can cause is profound. I know it is. And it's hard to think, and I get this. This is true in the chronic fatigue community. It's hard for people to wrap their brain around the fact that, oh, just a little stress is causing me to be disabled. Like I can't even work. I can't even take care of my kids. And the answer is yes. It is, and it can. And it's, again, you talk to PhDs about this stuff and they will tell you, of course it can, right? Because this is what happens and all that stuff. It's just hard for us to wrap our brain around it. I've yet to see somebody diagnosed with chronic fatigue that didn't have an underlying adrenal fatigue, at minimum contributing to, but oftentimes causing this chronic fatigue syndrome. And it's fixable with the right guidance. It absolutely is. So reach out to us, please. Please do. Okay, Cheryl says, holistic doctor appointment yesterday. Apparently my kidneys are highly inflamed and toxic. I don't know how they know that. Is this because of poor adrenal function? Diagnosed with adrenal fatigue and Hashimoto's in 2014. Well, if you have adrenal fatigue, that's an issue. Right thyroid goiter removed, lost a bunch of weight, gained some back. Yeah, I don't know. It's hard for me to say, Cheryl. I don't know how they know your kidneys are highly inflamed and toxic. That's more of an alternative kind of a diagnosis. That doesn't tell me your BUN's high, your creatinine's high. You have, I don't know what that means exactly. So I'm not sure how to guide you, but I will tell you, if you have adrenal fatigue is a broken stress response system. That system, and here's the problem when that system breaks, is that system is the control knob for your entire physiology. Depending on where your body perceives a stress, if there is a perceived stress, which our limbic system over-perceives stress, now you're going to turn on the organs of fight or flight, right? And you're going to turn on your heart and your lungs and your sugar metabolism, and you're going to turn off about everything else. You're not going to detox. You're not going to heal wounds. You're not going to control inflammation, right? You're not going to repair your mitochondria. Everything goes south when that happens. This has got to shift. So at a glance, I don't know you, right? But at a glance, it sounds like that's what you've got to fix. So that's what I would continue to go after. And Nettie says, what damage does adrenal fatigue do to the body long-term if it goes untreated? Well, here you go, right? That's what we're talking about. If we just think about the adrenals, not the rest of this system, let's just simply think about cortisol. And it's not simple. It's way beyond this. Let's think about cortisol. If you've got a cortisol issue, you've got a problem with your main immunologic control hormone, your main anti-inflammatory hormone in the body. Think about steroid use in this country. Steroids are given out like candy. They're given out all the time for all kinds of conditions. And they're life-saving if you use them once in a while. But when you use them chronically, inhale them into your lungs, stick them in your nose, take them for every scratch or allergic reaction or whatever it may be, you're overusing those steroids and they're going to cause problems. Steroids are mimics of cortisol. Right? So just cortisol, 4 or 5 times stronger. Logic tells me that if my body makes its own anti-inflammatory, and if I'm a doctor and I have to keep prescribing these steroids, right, that their body should be making, maybe, just maybe, this person has a problem with that gland making that anti-inflammatory. Maybe I should fix that. Yeah, logic doesn't work here, right? Logic doesn't work here. When your this control knob of your physiology is out of balance, it will lead to all kinds of problems. Again, it's connected to cardiovascular. I'm talking like the number one killers ultimately today. So cardiovascular disease, diabetes, autoimmune conditions, neurodegenerative diseases, immunologic problems. I mean, cancers, things like that. These are going to be contributed or connected to a broken stress physiology. It affects everything. And that's the challenge, right? It truly does. It truly does. Now, it is fixable. You just have to learn what it entails, what it takes to fix it, to bring it back into balance. It's not rocket science. It really isn't. But it is comprehensive. There is a lot to it. So the way, I've got to kind of work with my patients is, as opposed to, feeding them from a fire hose, like I just want to give them little sips at a time so we can lock all this stuff down. But you absolutely can fix it. And I would suggest, for your optimal health and longevity, you absolutely should. This is the number one chronic misunderstood condition that's out there. And fixing it has profound benefits way beyond just, some cortisol issues. Okay. All right. I am out of time. I got to just about all of them. Sorry if I didn't get to your question. We'll try to continue to do these here and there. I wish you the best in health. If you have any questions and concerns, please absolutely reach out. Check out the Facebook group is a great resource. There's a lot of good support, good people, good energy there. It's not a pity party. It's not a bunch of misery. We moderate that. We shut all that stuff down. Check out my YouTube channel. Tons of videos that we've now organized and created for people, symptom specific, condition specific, Q&As, Ask Dr. Neville. It's all on there. And if you ever need anything, just give us a call. All right. All my best.